I know you all are attending back-to-back classes and might be a little bored again to attend one more lecture, right? But I would like a more interactive session rather than me just talking. So I would request you all to use the chat option whenever I ask you any questions or if there are any clarifications. Okay? So some of the clarifications maybe we can take it in the end, right? Any questions or comments in the end. But initially, if I ask you something, please do interact. Okay, so that will make it our session more interactive and interesting, right? So we're good to go. We'll start with our topic for today, that is introduction to counseling. Okay, so I guess you all have a upcoming paper on counseling in your final semester. Right, so let's begin. Right. I hope you all can see the slides. Visible?
No, ma'am.
No. Right. Is it visible now?
Yes.
Yes, ma'am, it's visible.
Yeah. Okay, so let's begin. We start with introduction to counseling. So one of the first, few questions that pop up in all our minds will be, what is the meaning of counseling? Why do I need to go for counseling? Whom to go for counseling and when to go for counseling? Right? So definitely there might be more questions, but these are the initial questions for a person who is, a client who is trying to, okay, do I need to go for counseling, or whom should I go for counseling, or when should I go for counseling, right? So if I ask you all, okay, so if you could put in one sentence or in one word, what would be, what would counseling mean to you? Could you respond in the chat option? Right? What could be the meaning of counseling to you all? Feel free to respond. There are no right or wrong answers. Okay, Aparna has responded. Professional guidance given to psychological problems. Good. That's a good beginning, right? Help to overcome their problems. Yes. Sri Lakshmi has responded. Way of interacting with psychological issues. Neha and Fabia has responded to find solution from the problems faced by the person. Yes, you're all on right track when it comes to what it means by counseling, right? And as psychology students, we need to have a more professional understanding of what counseling is rather than layman people, right? From other, when people ask you generally, what do you do, right? It's all a standard question. Do you read my mind, right? So that's a standard question asked to any person in the psychology, in the field of psychology, right? So here we are going into understanding the meaning of counseling, and the initial responses that you have given is makes it understandable that you all know what counseling is, right? And you'll all be able to explain to another person what counseling is like, right? And let's move ahead with regard to seeing what counseling comes with, what are the levels of counseling, what are the techniques used in counseling, right? What is the method of counseling, right? And so you get an overall idea about what counseling is, and you will be able to better guide when you become professionals and start seeing clients, right? Okay, so coming to the next question, why do I need to go for counseling? So I think more or less, from the responses I understood that it's for, gaining solutions to real life problems, right? Whom to go for counseling? Could you all respond? Whom to go for counseling, right? Whom to go for counseling? Psychologist? Yes. Okay, let's come to a very basic idea. Okay, so let's say that initially when you all had certain issues, or maybe some real life issues, or anybody, not necessarily you guys, but generally anybody who's having issues, would they go to a psychologist first, or who do they take help from? Yes, family, friend, right? So that's a more way of helping. Okay, so who is, when we talk about helping and counseling, okay, so helping means the more from your family, friends, teacher, right? So you're taking, a lot of, it's a more informal way of getting solutions for your problems, right? So when, in the current scenario, definitely, when the initially it was a joint family system, right? The olden days. And there were, if anybody has an issue, automatically there were many people to help, right? Sometimes it ends up in disaster, but sometimes it really helps out the person to really sort out their issues. But right now we have moved ahead, right? We understood the need that there is a need for an objective third person to really be there for you in understanding and sorting out your problems, right? So that is in terms, so when you mentioned, okay, therapist, psychologist, right? So you mentioned therapist, psychologist. Yeah. So these two terms you have mentioned, right? So anybody knows, can respond difference between a psychologist and a therapist, or are they same? I know it can be very confusing in specifically in our Indian setup. Not just Indian setup, throughout I would say that more or less these words are used interchangeably, right? Now, if you ask me, a psychologist would be somebody who has a, definitely when you call somebody as a consultant psychologist, who has a basic master's degree. Okay? So master's degree in psychology. So it can be either counseling or clinical, it doesn't matter which particular branch you are specialized in, but you are called as consultant psychologist after your master's, right? Now therapist doesn't mean, there are many people who don't even have a psychology background or a master's end up being a therapist because they've specialized. For example, there are many therapies, right? Cognitive behavioral or existential. So they specialize in that particular therapy and then become therapists, right? So even people from various backgrounds can get specialized in certain psychological therapies and become therapists, right? So there are people who are in the business area who goes on to become therapists. So but because in India we still don't have proper guidelines, right? If you look at any other country, there are more guidelines, but in India we still don't have proper guidelines as to defining these terms, right? Now, why? How come you have not mentioned counselor? Right? Any particular response to that counselor, or there's a term now, counseling psychologist, counselor, counseling psychologist. Okay, so if you're not responding, I will I will tell you that now counseling psychologist is also in Indian setup again. I'm pinpointing this because Indian setup in counseling psychologists is called as counseling psychologists even after masters, but in abroad they called as counseling psychologists only after their PhD, right? So, and in counselors, now counselors again we have the professional counseling and the layman, lay counselor training. Okay? So, the lay counselor training means anybody who has not had any, basic background in psychology goes on to become a counselor by, doing the course of lay counselor training. Definitely, person who has completed the graduation and the masters goes on to become a counselor, right? Now professional counseling is what we generally learn in masters, right? Now you can people use the term as counselor and psychologist interchangeably, right? Now why what is the difference? I would say is psychologist means you have a understanding even in terms of the assessment part, also testing, research, right? All of these comes when you are going on to become a psychologist. But in counselor or professional counseling, it's more we are completely restricting our practice into only catering to the clients, right? And there's nothing else. There's no research, or there's no particular what you say theoretical background, a very in-depth theoretical background. All this would be missing from a counselor will be very efficient in getting clients, handling with clients, but obviously you need a more professional experience while handling clients, right? So that's why always a master's or a undergraduate degree and a master's degree would really help you, to have a strong base so that you can be more efficient in handling clients, right? So we are going ahead in terms of, okay, so whom to go for counseling. It's still, there are, it's a debatable topic actually. There are many professions here and there. Even nowadays, people who are doing social work, they also become counselors. So it's all if you look at abroad, it's roles are very much defined. Okay, the roles are defined very distinctly, but in Indian setup, it's still going here and there. Fine. Now coming to when to go for counseling. Any idea when to go for counseling? Could you respond? When to go for counseling? Yeah, when we have problems. Yes, right? When someone needs an emotional or mental support, when we are weak or depressed, right? Depression. Okay. When we can't handle the problem, when we think we want support. Yes, right? When we don't know, we can make decisions, right? We have learning or behavioral issues, right? Right? Good. Okay, so the responses are great. Now, I would like to point out this particular, response given by Sri Lakshmi when we can't make any decisions, right? When we're stuck in a crisis or when we are not able to make any decisions, and this can happen with anyone, right? So it need not be that okay, a person who is having depression or who's having a big problem, is only will go, or approach for counseling. Anybody, for example, an adolescent who is in the transitional period, right? In facing these challenges of the adolescence, how to handle these problems, and this can happen with everyone, right, including me, right, or anybody who has gone through adolescence would have had certain challenges, and maybe they need help, and that time also you can resort or you can take help of a counselor, or a professional counselor, right? Now, and this but in an Indian scenario, it's still a stigma. It's still a lot of labels to it as to okay, this is something that you can only handle. Why do you want to go to a professional person? Why do you go to an outsider and share your problems, right? What is your opinion with regard to that? What that you're going to an outsider and going sharing your problems? What's your take on that? How do you see it? Okay, or in other ways, if I rephrase it, we are going and sharing our problems to a outsider rather than a family person. Why do you think so? Why are we doing this? Right. Good. Being non-judgmental. So you're coming up with the skills of a counselor, right? They don't judge us with the past, right? Some things cannot be shared to family, so that's self-disclosure. So how much you can close. So you're talking about boundaries, right? Where do you set the line, right? So there are things which we cannot share with your family, and some things we share with friends, right? Some things with family, right? And at that time maybe there are certain issues which you want to deal with, but you are not able to share with your family or friends. And at that time this particular counselor, this particular person who is non-judgmental can help you out, right? Good. That's that's a good way of seeing the in terms of when to go for counseling and why are we going to this particular person who is an outsider, right? Now let's go ahead to myths of counseling. Okay, so so sorry. So there are many myths of counseling. So one is like it's like advice. Okay, right, and so it takes a very long time. Right? Somebody says, okay, I tried once to go for counseling, it doesn't work. The person just keeps talking and it doesn't work, right? And counseling is only for serious mental health issues. That's another myth, right? And it's endless talk about past, right? So it's just about getting the history or getting the information from the client, and that's about it, nothing much, right? And taking help is equal to weakness. So counseling is seen in a way that okay, you take help, that means you have some serious problem, or you are you don't have the strength enough to handle your own problems, right? So these are the general myths. You have anything to add on? You have anything to add on to myths? Yes, yes, people say they will read our mind and secrets very much, and that's one major, concept in people's minds, right? Okay, so it's like the moment you say you're a psychologist, it's like okay, it's a deep silence that comes in between, right? That okay, do should I say something? Is the way they going to maintain the eye contact with you? All of this gets a little creepy, right? Okay. Any other myths or any stigma that you have seen in general society with regard to counseling? Right? You all can respond. I'm not going to ask you any questions individually, so you don't have to feel scared. You can keep responding. Right. What are you going to do after that? You have to study lifelong. Okay, so that's a interesting way of seeing that, right? So that's in terms of the career side to counseling, I would say, right? In terms of yeah, because definitely if you need to become a professional, it's a long years of study, right? So maybe when you know your friends are in other field like other business or commerce, mostly people after undergraduation itself will start earning and having a job, right? But definitely with fields like this, like medicine and health professions, you need long years of study to go ahead, right? Anything else? If not, we'll continue. Okay. Cool. So these are some of the myths of counseling, and we then now we go to the common worries of about counseling. So some people say that issues of trust, right? So do I need to tell all of this to this person, or do I hold back, right? Some people say it's a waste of time, right? Some people say okay, whether this person is going to judge me, right? Specifically with children, you see, right, that if they are if they come to the counselor, they will take a couple of sessions to open up because they're scared whether the counselor will talk all of this to their his or her parents, right? Even with adolescents, so a lot of issues of trust comes in that whether to disclose it or not, right? And also in terms of scared about too much of disclosure. Okay, once the session is done, it's like, why did I talk so much to that person, right? Or is he going to, or is he or she going to take this against me later, right? Shame and guilt. For some people, it's a very, shameful thing. Okay, do I need to even approach a counselor? It's a very shameful aspect. And also in terms of when, okay, after they have shared all these personal details, then they feel shame and guilt about sharing this, right? So these are the common worries that people face when they have to make a choice whether they need to go for counseling or not. Anything else to add on from your side? Common worries? Right, somebody else is when people say that family, friends are enough and no need for extra counseling and all. Yes, very much, Aparna, right? That family and friends are enough. Why do you want to go for a session? Why do you want to pay this much, right? That's another one. Why do you want to pay so much money and go and sort out your problems, right? Does this help really? Right? Does this help really? Right? So these are the, these are genuine worries, right? Genuine worries, because if you look, if I just give you an outside, I mean the abroad situation, there I think almost every person, every adolescent would have undergone gone for counseling, right, or long-term therapy to sort out their issues, and they know the benefit of that. But definitely there is insurance, right? So even for mental health difficulties, or even for therapy, they are insured, right? So here it's still in the process, it's still not come up, right? So once it has come up, it will be much more helpful for the people to come in front and take help, right? Is it affect our mental health? Okay. I think you are guessing that whether counseling itself will affect your mental health. I mean, can it be dangerous to you? Right? There are people who are thinking that also, that somebody can literally control your mind and make it worse for that person, right? So right, some people also say without medicine, how problem will be cured? It's an illness, right? Right. So on that point, I would say we need both. In certain issues, we would definitely need both medicine and counseling together. Right. So we cannot let go of medications completely. Right. Then that means he or she is a fake counselor, I would say. Right. We always need to be aware of that. Okay, there will be a component of the medications in certain conditions, right? In certain severe conditions where where the client is not at all responding, the client is not even talking, right? Then what counseling would you be able to do, right? So at that, in those times, definitely we'll need the importance of medications also, right? Right, there's a sort of social rejection once. So the many people, okay, even in school settings, I have seen that when a counselor is there and when some students have gone, then everybody is okay. He has gone to that person. It's like that. Stigma is a lot of there, and I just want to narrate a small incident before going ahead. That one of the students in college wanted to come and consult me. But initially, she actually, made a call to me and said, "Ma'am, I would like to interview you because you're a psychologist. I want to interview you." Right. So I was like, okay, let's go ahead and I'll give you a date and all that, right? But later, the next time she called, she said it's not for, it's not for interviewing. She really needed a session, and but she didn't want anyone to know. She needed a, because I was practicing in the college, okay, in Rajagiri College. So she wanted a place where nobody sees, none of her friends see that she has come to the counselor. So even we are talking about awareness and all of that, but still, in the urban setup, Rajagiri College means in Kochi itself, right? So I'm not picking up colleges, but I'm saying that generally, even students of this generation also have that difficulty in accepting and feeling that freeness to go and approach for help, right? Right. If it's wrong according to social standards, is it normal or is it really need to consult? Right. So let's go ahead. Right. Okay. So it's a quote by Carl Rogers. I hope you all know about Carl Rogers. We think we listen, but very rarely do we listen with real understanding, true empathy. Yet, listening of this very special kind is one of the most potent forces for change that I know. Right. So the way we listen to people, the way we understand and make sense of what people say is one of the most potent forces of change that Carl Rogers know. Right? Coming to right, what is counseling? So we're coming to the main question as what is counseling? It's a relatively short-term, interpersonal, theory-based process of helping persons who are psychologically healthy, right? And also resolve developmental and situational problems. So counseling is mostly used among people who are psychologically healthy. Means we talked about normality and abnormality, right? So mostly in the normality category, that is where we use counseling, right? And it's a short-term interpersonal theory-based. Theory-based means or any technique that you use or any aspect that you are interacting with the client, there is always a theoretical base to why we are doing some certain things, right? Now in the session, somebody has come up with certain issues. You're taking out one issue and you're trying to sort it out. Why have you taken that particular issue first? What is the rationale for that? Right? So all these things, as a counselor, you need to be very aware of, right? It shouldn't be that okay, just come, just give advice and over. No, it's not at all just passively listening and everything is okay. No, right? Counseling deals with personal, social, vocational empowerment and educational concerns, a process in which clients learn how to make decisions and formulate new ways of behaving, feeling, and thinking. Counseling is conducted with persons who are considered to function within the normal range, usually, right? Now, there are a lot of modifications, right? This is the traditional way as how counseling is seen. Fine. So the major skills of a counselor from, according to Carl Rogers, that is unconditional positive regard, empathy, genuineness, and non-judgmental. Right. So I hope you all know these terms. Unconditional positive regard means you accept the person even when they have not done anything for you. Right. We talk about the early childhood experiences, right? The parents generally what they give that worth to that child only if they have done something. So that unconditional positive regard is not happening. So and that can create issues for the person. Empathy, right? Feeling you be feel with the person, right? Whatever the person is feeling, you can also feel. That is empathy. Genuineness, you're really very much concerned and being committed to that particular client of what their issues are, right? And non-judgmental, definitely not having any preconceived notions of what the problem is to be or what okay, somebody is using substance, right? And if you hold a very judgmental stance, okay, people should not have alcohol or people who have who take substance are very bad. Okay, so if you have these judgments, it's time that you start working on these judgments, right? As as like a self therapy, right? So that is also needed. We'll talk about that, right? But we need to work on our judgments as a counselor as well. Okay, so moving forward, we have the general format of a counseling session. So we have relationship building, that is you establish rapport with the client, right? Then you have the in-depth exploration, that is you are assessing the problems. What are the problems that the client has come up, which is more priority. You have to prioritize which needs to be focused right now, right? Goal setting. So from these problems, we are taking up few and we are making a goal list and as to which needs to come first, which needs to come last, right? All of that. Then comes the intervention. Definitely, we use certain techniques, we use counseling skills, right? All these skills, we'll be coming to that listening skills, attending skills, all of those skills too, with regard to motivating the client towards change, right? And evaluation by termination and then follow up, right? So, this is the general format of a counseling session. Right. So far, any doubts? So far, any doubts? Okay, cool. Right. So we're going ahead. Need for counseling. So you've already mentioned that what would be the need for counseling for self-awareness. That's why I told that adolescent who is going through a transition might just need for self-awareness. They can go for counseling and forget about any issue. You just want to know more about yourself, right? You just want to know more about what your beliefs are, what your values are, what your attitudes are. Just want like a personal improvement. At that time also you can always resort to counseling, right? Crisis or decision making, grief or adjustment, right? Okay, so these are few of the definitions. So I've included some of the academic side to this as well. So you have a couple of definitions, right? So I'm not going in depth. You can, I can share the slides with you, so you can always go back to these definitions. Now, okay, here what I'm saying is counseling and guidance. Okay, so there's a term called guidance or helping. These are, used interchangeably sometimes. Sometimes the principal sometimes talks and just please counsel that student. Okay? So maybe what the principal or what this authority is intending to is just helping or just guide the student. So the way counseling and guidance are used, it's used very much interchangeably. Now, coming to the comparison, right, about with counseling and guidance, right? So, in guidance refers to an advice or a relevant piece of information provided by a superior to resolve a problem or overcome from difficulty, right? So, guidance is more like advice, right? And it does, it's more education and career related, and counseling need not be so, right? And usually guidance is from a superior person or an expert person, right? But in counseling it's always equal, right? So definitely counseling counselor means definitely who has a skill in professional and professionally qualified. But when you come to a counselor and a counselee relationship, it's more or less equal. It's never that the counselor feels themselves as superior and the counselee is inferior, right? Now, right. So then the guidance is more or less open and less private, but in counseling it's very confidential, right? And in guidance, it's usually you can do it with large number of people. Also, sometimes you can do guidance, but counseling definitely the group counseling format is there. But in traditionally, it's more. Or it started with one-to-one counseling, right? And decision making usually in guidance is by the guide, right? And counseling mostly by the client. The client would say when the client wants to have the sessions and terminate, right? And sometimes the therapist also, but usually it goes with the client's decision, right? Now we're going with, so we looked at the definitions when we saw what is the difference between counseling and guidance. Now, really what counseling is. So counseling is a profession, right? It's not, it's not something like advice or it's just something that anybody can do. No, it is a profession. A profession means it has certain things to be, right? What medicine is a profession. Can you go and do medicine without going through that 5 years of training? No. Same holds for counseling or in the professional psychology as well, right? Counseling deals with personal, social, vocational, empowerment, and educational concerns. Counseling is conducted with persons who are considered to function within the normal range. Clients who have adjustment, developmental, or situational concerns, and their problem require short-term intervention. So counseling is more or less short-term compared to therapy, right? So therapy, there are brief therapies nowadays, but in traditionally, when you have to clear cut, say what's the difference between counseling and therapies. Counseling deals with definitely more or more they target people with the normal range. In therapy, definitely you are looking at even severe psychological disorders. You are resorting to therapy. Therapy definitely has a more focus on the past concerns, and counseling is more on the present, wherein okay, what are the current adjustment issues, what are the current vocational issues, what are the current learning issues, right? So it's more of a current, the present approach, right? In therapy, more in, going and digging in the depth of what is the source of the problem, and all of that comes in. Right. So, in counseling is a process in which clients learn how to make decisions and formulate new ways of behaving, feeling, and thinking. Counselor focus on the goals their clients wish to achieve, and counseling definitely encompasses various subspecialties. You have various. Look, you have vocational counselors. There are so many branches. The military, any setting you take, there are counseling branch, or the counseling psychology branch has branched down to various small subspecialties, right? So some of the qualities, as you've all mentioned, maybe can you put on some of the qualities in the chat? Qualities of a counselor. So one of that you have mentioned being non-judgmental. It's more of a skill. But what could be the qualities? Qualities. Okay. Qualities. Patience. Right. Patience. Right. Skill and qualities. Right. Good listener. Okay. Listening is more of a skill. Quality means something that we already have. Right. Somebody who is patient enough, right, empathetic enough, understanding enough, right, compassion, good, open minded, right? Okay, and these qualities are something that we need to work on to make it as a skill. Right? Skill means it's something that we are using actively when we are with a client, right? So let's see few of, so understand the feelings, that is empathy very much, keeps all information confidential. That means you are not breaching the trust, right? So sometimes this happens that when you have a client, you sometimes discuss these clients with your other people, and that's very very bad, right? Even if it's even if it's your colleague also, you need to take a lot of concern, specifically in a educational scenario. I'm speaking, if it's with the professional colleagues, if there is a different, professional supervision we call, right? So if you're discussing a client in supervision, that is fine. But if you're discussing just randomly about certain clients with some others, that's not, ethical, right? So facilitates discussion on the issues. Okay, so you're facilitating the discussions, building self-esteem, reassurance, right? Um, okay, empathetic, patience, right? Not getting distracted, right? So and considering, goal setting. So all of these are qualities. So how you are able to manage the session with the client, right? Um, Avoids acting like an expert. That's what I said. It's not an expert. It's not guidance. It's not like you have a research and you have a, you're going to a teacher for a guidance. Definitely the teacher is a expert, right? But here counselor does never speaks in that way, that I have all the answers and you don't know anything. No, that is not at all the approach. Actually, it's the entire opposite, that the client has all the answers and we are just facilitating what the client already knows, right? And has a big ear and a small mouth for listening. So more than speaking, it has to be more of listening, right? Skills, attending skills. So how much of attention that we are giving to the client, right? Even our body language, right? So how much we are, the distance between the client, right? How much are we leaning, what are our gestures, right? All of these matter in terms of the skills of the counselor. Observing, right? Even when the client comes, from outside, just entering the session, from there your observation starts. As a counselor, you start your observation from there. And the questions, right? So what kind of questions you ask, right? So there are many kinds of questions, right? Open-ended questions and close-ended questions. So the how you use these questions to elicit information from the client. Silence. So you need to use silence also. Sometimes when the client is, sometimes the client can become confused, and at that time he or she needs some silence to reflect, and then the client itself will come with a, alternative solution. So you should not jump and give the solutions. You need to pause and see what when and what and sorry, where and when to use the silence, right? Great. And then responding, so it's reflecting. So you also serve as a mirror for the person speaking, right? So reflecting his or her feelings. Probing, right? So it's not that's why counseling is an active process. It's not that we keep as a passive person and just keep listening. No, we do ask, we do confront certain things, we do ask for elaboration, right? We ask for certain, we do repetitions of certain things that the client has already told, right? So it helps the client to fill the gaps what they are trying to communicate, right? Great. And then you have the interviewing skills, right? So that is what we were talking about, open-ended questions. That is, you can ask this question like, can you tell me a little more about yourself, right? So that's an open-ended question. Closed-ended is a more of a yes or no. Okay. Have you eaten today morning or not? You say yes or no, right? So that is a more closed-ended question. And counseling, both are used, right? Here and there, both are used. Then you have paraphrase, so you're summarizing the client's needs, right? And paraphrasing. So, for example, somebody has said, okay, uh, fine, I'm not feeling well today because of so and so reason. So you are paraphrasing, okay, for so and so reasons you are not feeling bad. I mean, you are not feeling well, right? So you're paraphrasing, and summarizing is also uh, comes under paraphrasing, but it's also a skill by itself, right? Summarizing. So after the entire session, you can summarize, okay, this is what we have done today, these are your issues, right? And this is what we are going to go ahead. Summarizing also can be done in between the sessions also, right? In between the session also, as and when the client is going through with the problems, right? Resistance. So sometimes how you can handle resistance when a client is not talking at all, okay, or a client is not giving you valid information. So how you're going to use these skills like listening, responding, probing, all of these, how you're going to use to handle the client resistance. And listening is the most important, active listening, right? So it develops a positive and healthy interaction with the client, and it builds a rapport, and it improves overall communication. Right. So till anything to add on to skills? I hope you are clear. I know I have to rush with few things. Maybe in the end, if we have something to add on, we'll add on. Okay. Fine. So goes to levels of counseling. Right? So there are many levels. We have three levels: informal counseling, non-specialist counseling, and professional counseling. So informal counseling is what we talked initially, right? So a person who does not have any professional qualification, could be a family relative, friend, or a colleague. Right? So you people generally who give advice and who tries to come up, sort out your issues. That's informal. Non-specialist, like teachers or doctors or lawyers, but don't have any particular specialization in handling psychological problems. Right? There are teachers who give you, sometimes solutions to your problems. There are students who approach teachers with personal issues. Right? Even if they are not in psychology teachers, right? So there could be, if you look back at your school time, there might be teachers whom you have, said a few things of your personal life, and they would have supported you, right? Now, then comes professional counseling, right? So, professional counselors are the ones who have received special training in counseling and have the required qualifications. These counselors deal with personal, social, emotional, and personal problems. In the counseling process, the professional counselor may use different techniques. Right. Now, going to techniques. Okay, so we are going to the techniques, and these based on the method of counseling, these techniques differ, right? So there is directive counseling, there is indirective counseling, non-directive counseling, and effective counseling. So based on these three, methods or types, I would say the techniques differ. Not very drastically, but it differs here and there. Right? So here, if you see the directive counseling given by E.G. Williamson, these are the steps. Okay, so there's analysis, synthesis, diagnosis, prognosis, counseling, and follow. right? So analysis means you are getting few information and trying to understand, okay, what is it going to be. You're analyzing the problems, okay, so you're trying to get various information from multiple sources and trying to come to a conclusion. And synthesis is you are organizing and summarizing the data, right? So your synthesis is you are seeing, okay, these are the problems, what could be the good side to it, what are the assets, right? What are the difficulties that the person is having, but what are the good adjustments also that the client is going through. Then you're coming to the diagnosis, okay, what is exactly the problem, right? You're coming to a proper understanding of what is the issue, right? Prognosis means what, in terms of you're predicting whether the client will improve or not. Prognosis is always the future. Okay, so future development of the problem. Is it going to be better or is it going to be worse? Right. So we talk about good prognostic factors and poor prognostic factors. Then we have counseling, so that the intervention takes place, and then the follow up. So these are the general. What do you say? It's a more structured. Okay, so directive means the counselor has the role in deciding how the sessions have to go. Okay, so the um, it's mostly decided by the counselor. We're coming to non-directive counseling. It's by Carl Rogers. Here, yeah, if you see these steps, right? So it's defining the problematic situation, free expression of feelings, classification of positive and negative feelings, development of insight, and termination of counseling situation. So you look at the change here. It's more structured. You're analyzing, you're synthesizing, you're coming to a diagnosis, right? But here it's like it's more free flowing. Okay, according to Rogers, it's that when you know your feelings, when you in depth, when you analyze your feelings in depth, it automatically leads to insight and you start changing by yourself. So client has a more role than the therapist here, right? So free expression of feeling, classification of positive and negative feelings. So you look at in the session, you look at both, and the counselor accepts both the positives and the negative feelings, right? And then you terminate, right? I'm not going into details, right? You can read from the slide later, right? So these are the steps of non-directive counseling. Now coming to eclectic counseling, and which is what we use mostly. We don't use directive counseling or non-directive, separately, because it has both the advantages and disadvantages to it. So we'll use eclectic counseling where they have mixed up both the models. So both the good points of both the models, the directive and non-directive, and they've come to a counseling model called eclectic counseling. So it's a synthesis and combination of directive and non-directive, right? And the counselor is neither too active as in directive or not too passive in non-directive. And these are the stages of eclectic counseling. So there is a diagnosis, the analysis is done, the preparation of, or what are the there's a plan for what needs to be modified, right? Effective conditions for counseling, right? Securing effective conditions of counseling. So if you look at Carl Rogers' theory, effective conditions, unconditional positive regard, empathy, right? Being non-judgmental. So all these things are also coming in the eclectic model, right? So there is structure, that is diagnosis, analysis, and preparation, but there's also those client-centered factors and also the therapist factors with regard to the skills coming into the picture, right? And to assume its responsibility for trying new modes of adjustment, right? So you're entrusting or you're helping the client to be more, to take more responsibility with regard to, or trying out new modes of adjustment, proper handling of any related problems which may contribute to adjustment. So basically, it's like there is a structure, but the ultimate handling and the responsibility lies with the client, right, with regard to change. Right. So we go ahead and we come to the Egan's skilled helper model, and that is what we call the eclectic. Under the eclectic model is the Egan's skilled help per model, and it's one of the major, mostly used, even not in counseling setup, even in industrial setups and all, or industrial psychology also they learn about this, right? So Egan's skill helper model. Here you have certain phases. Okay, so you have three stages, but there's a pre-stage before the three stages. That is what we call the pre-helping phase, right? And it's called attending, right? And it's defined by a few characteristics. Okay, so one is squarely, okay, S, right? So squarely means you are how you're sitting with the client. So it's basically the setting of the counseling space. Okay, so how you are sitting with the client. O is maintain an open posture with the client, right? L is lean towards the client, right, as appropriate. And E is appropriate, maintaining appropriate eye contact, right? And R is be a relaxed person, right? So these are few of the skills that you need to have before even starting the session, right? So you have to make sure that these things are in place before you start the session, right? Right. Why are we talking about all of this, right? These skills and stages and qualities. What do you think is the need for all of that? Okay, we could just okay, the person could come, we could just talk, and that could be over. But why do you think these many specifications and all of this are there? What do you think? Could you respond? It should be effective, yes, right? To maintain a good relation, right? Anything else? Right, they should feel they are in the right place. Great, right? So all these things we have mentioned because counseling is a profession, right? And professional means there needs to be certain, rules and regulations and all of that, right? That we need to abide by, right? Because otherwise it would be just like somebody else giving you advice, right? Somebody else, yes, ethics, right? So somebody else giving you advice on certain things, which sometimes it does happen, right? That uh, when somebody cries or when somebody is upset, the immediate reaction from the family is don't cry, right? Or don't be upset by being a child, right? So these things are there very well in the family system and friends also sometimes, right? So but that is how you differentiate you as a counselor from others, right? So that's the professional means the being a counseling professional means you need to come up, you need to have ethics, yeah? You need to have that setting and you need to have the skills. All these three are in setting, you can be a good counselor, right? Okay, so I think we go ahead with Egan's skilled helper model, right? So the stage one is exploring the client's existing situation, right? So here we ask open-ended questions, use silence, right? We focus on empathy, okay? So paraphrasing and reflecting meaning, paraphrasing and reflecting feeling. So meaning means when the client has made sense of something, you are again, reinforcing that, right? You're reflecting, okay, so you meant this way. Reflecting feeling means client says something about, okay, I feel so and so, you are again reflecting, okay, so because of this you felt so and so, right? So it's like a, it's giving a validation to the client that you actually felt that, right? And structuring, so definitely you structure with regard to existing situation means generally the past, right? So whatever the client has been going through a little bit, in terms of so the client comes to you, so what has happened before, okay? Past doesn't mean early childhood, past means just before the client has come, what has happened that has led to this present situation, right? And summarizing, right? So this is the stage one, right? So you use a lot of open-ended question. Can you tell me about yourself, right? Uh, how have you come here? I mean, how, what, how can I help you? It's very uh, very nice question to start with, right? How can I help you? Right? Okay, stage two, that is understanding skills. That is, you are recognizing patterns and themes. So from whatever the client has told, you're recognizing, okay, this has been a pattern with the client, right? There are recurrent themes that the client is having, right? Alternate frames of reference. You can even ask in terms of, the same condition happened to somebody else. How would, what would you tell that person, right? There are particular techniques even in other therapies also they use, right? Self disclosure is very tricky. Okay, so there are times where therapists say some of their aspects, okay, that I handled in in so and so manner, but it's a very it has a got a lot debatable, right? So some people say that or some researchers say that you can talk about your personal experience, but you have to make it like a outsider example, right? Somebody, you put somebody else in the picture or some hypothetical example, and you can narrate it. Immediacy. So what is needed right now, what needs to be immediately intervened, right? So it's like the doesn't mean that there are a lot of problems and you have to cater to all of them, all of that at once, right? You can prioritize which needs to be immediately intervened, right? Challenging timing and placing, right? So where you need to uh, okay, what needs to be, so the timing and placing, so what needs to be handled when, right? And advanced empathy with understanding. So you not only just being and feeling with the client, no, you are actually understanding and reflecting what the client is saying, right? So that is advanced and accurate empathy, right? Now coming to stage three, that is action. Okay, so first it was you looked at the existing past, then we came, okay, you understood the client. Now we are coming to the actions. Here you help the client to develop strategies. Divergent thinking. Divergent thinking means from one aspect you are going to multiple possibilities. So that means what happens generally when a client is depressed or having suicidal thoughts. It's just that narrow thinking, right? The convergent, all convergent actually. Everything what the client thinks goes back to that one point that life is no more needed, right? But divergent is that life is no more needed. Okay, what are the possible outcome? What possible alternatives? What are the possible? So we are talking with the client with regard to what are the possible alternatives, and we are training the person to think more divergently, right? Goal setting, decision making, problem solving, right? Evaluate knowledge of resources, teaching skills, and promoting learning skills. Right? So these are the three stages of Egan's field help model, which is an eclectic model of counseling, right? Um, Right, and this would be my last slide for today, and we could have some interaction in the coming some time, and then we can close. Okay. So this is the three stages. Now, stage one, as we just mentioned the same thing in just a table format. I just saw in one of the books and found it interesting, so I thought, right. So here, what present, what is going on, right? What do I need or want instead of what I have, right? And how do I get what I need or want, right? So present means in terms of what existing situation. Okay, so what is happening with the client, right? What has been happening with the client, right? Also, it helps the client to tell their stories, and here helps the client break through blind spots. Blind spots means there are particular areas in your awareness where you haven't given attention to. So there were few areas in your mind where you have not given attention to, and those experiences might have been very important, or those issues might have been important for you to resolve, right? So those are blind spots, helping clients choose the right problems or opportunities to work on. So when you address these blind spots, you would understand, okay, which problem is really, that I need to work on, right? Then coming to stage two, that is preferred. Help clients use their imagination to spell out possibilities for a better future. So what does the client wants, right? From all okay, these are problems, these are going on, but what does the client want, right? So help clients choose and realistic and challenging goals. So there will be many people who will say, okay, I want a life like this, right? But sometimes it might be too idealistic, right? So we need to get the client into having more realistic and challenging goals, and help clients find incentives that will help them to commit to their change agenda. So, how the clients are going to come with alternatives, and what will work for them, basically, right? And then coming to action. So, may help clients see the many different ways they can achieve their goals, helps client choose best fit strategies, and helps client craft an action plan. Right? So these are the three stages where this is a very what do you say, helpful model, for even with the clients. It's not just a theoretical where you have to learn it for your academic purpose, but it's also a good model that you can use as a professional as well, right? So I think I was I have covered few of the things. We have not gone in detail. Like I didn't want to read out slides. I think you already would be kind of doing that right on an everyday basis, right? So if there is anything more that you want to discuss about, or any interaction, any questions, any comments, anything that you want to ask, you can even unmute and ask. That's fine. Or you want to ask in chat, that is also fine. Okay. What is your thoughts on virtual counseling? Is it sufficient? Yes, definitely there are limitations, right? But if you ask me, like I am doing private practice online right now, and if you ask me, a lot of people are coming forward. I would say it might not be sufficient. Maybe the connection between the client and therapist has a lot of limitations, I would say, looking at the non-verbal expressions, all of that. But I would say, with regard to stigma and all of that, uh, more people are coming forward for counseling. So if you weigh the pros and cons, I would go with more of the pros, right? Uh, yeah, that would be my answer to that. Right. And does client problems affect our mental health? Yes. If does, how to deal with? Yes. Good. Good that you mentioned this. That if you look abroad, any person who starts seeing clients has to undergo their own therapy, right? And here again, there are no rules as such, but it's actually there are a specified number of hours of personal work or personal therapy that you have to undergo before starting to see clients. And many of people who are practicing here in India have not, right? And it's actually really what I would say is it's a damage that you're doing to your clients, right? Because obviously your judgments, or sometimes when you are listening to a client, the same problem might have happened to you, and you will start thinking about that, right? And so where is the active listening, right? Where is being with the client comes in, right? So all of this um, you know goes with that. How to deal with transference? Okay, so transference is generally when the client feels very attached and affectionate, right, with the therapist, or sometimes giving gifts, that usually we acknowledge, and we acknowledge this transference, and you actually take it as a what do you say, you do not say no to it completely, like, right? For example, if somebody comes with you a gift, right? So it's in Indian culture, how is it, if you don't take the gift, it's like a it's like a disrespecting, right? In Indian setup. In Western setup, they generally say, okay, it's according to my ethics, I cannot take clients. But in Indian setup, specifically in rural setup and all, somebody comes with you, you do that, it affects the relationship also. So what generally is done, either if it's something, if it's not a very personal gift, like it's some food item, it's something like share it with everybody around, something like that. Or if it's a particular gift, then you politely say no to it, because it's because of certain limitations you have as a therapist. That is why you are not able to. Even dealing with transparency, when somebody, after a couple of sessions, the client will be so happy with you that they start sending you Facebook requests, start chatting on WhatsApp. All of these have to be politely refused, right? So you can say, as a therapist, you need to maintain a certain professional relationship with you, and that is why you cannot do that, right? Ma'am, how to handle situations in which we are unable to relate to problems of our clients such that makes us inapt to respond similar to their perception. How to, which are unable to relate to the problem. Okay, so if you feel that you are not confident enough to handle certain clients issues, one is you be in supervision. So you always have a supervision from a psychologist or a senior person in the field, right? So that you get, actually it's a norm, not everybody in India. Again, in India, nobody else goes with supervision always. Once they are qualified, then they just start practicing. But that is also not the ideal way of doing. Okay, even if you look at abroad, everybody is in supervision in the initial stages of their practice. Actually, for many years they are in supervision. Why? So your confidence naturally develops in handling certain issues. So you'll be having a supervisor whom you will discuss your cases with, right? And so you will get more idea with regard to, and even after supervision you feel that you're not confident enough, or the client is expecting something completely different. Like, for example, if you are trained in counseling approaches, or you are trained in cognitive behavioral therapy, or any of that, but the client wants hypnosis, right? So, and that's something that you don't know, and you can easily refer to another person. Do not have any bad feelings with regard to that, because what and sometimes certain clients won't be, you won't be able to deal with. And if you feel that resistance within you, right, sometimes that can happen. Okay, that as a therapist, maybe you can, right, okay, this client, I'm feeling some kind of anger within me with regard to this client, and these issues, if it goes more, and if you feel really difficult, you can always politely refer to another person. That's possible, and that's a good, the best way to handle that, right? How to deal with our emotions while counseling client, is that hard? Yes, it is hard, right? So that's why I'm saying the personal therapy work is very, very important. Otherwise, it's all going to affect you, right? It's called going to affect you as a person, and it can take out a lot of your energy, impact your emotions. So, personal therapy, you being in personal therapy, and you, so that you will also start sorting out your issues, right? So once you keep sorting out your issues, then somebody else talking about their issues won't affect you that bad, right? And definitely in therapies like cognitive behavioral therapy, or the behavioral side, or the involvement from the therapist won't be that deep. But compared to, if you look at existential humanistic or psychodynamic, there the involvement, the relationship, the therapeutic relationship itself is the therapy, right? So there, if you look at the rules and all, everybody who is um, practicing psychodynamic, they are in, they have undergone their personal work, right? They have undergone their personal work. So that is one way that we can deal with our own emotions, right? Yes, does personal problem of the counselor? Yes, very much. Personal problem of the counselor does affect the counseling session. So that again, the same point, personal work, right? Personal therapy of you, and if you do it earlier, that's good. Like by right now you are in graduation, right? So by masters, if you could start your personal work also, right? By contacting somebody, some person, some senior person in the field, some psychologist, right? So who can be your personal therapist as well, right? How to prepare for counseling, right? So as we mentioned, in if you're looking at the stages, definitely the initial is more about rapport and all of that. And I would say more than preparation, it's the skills that you have. So automatically in that spontaneity, you will start addressing certain issues, and you will, okay, you tell the client, okay, these issues are happening because of these, and these are the all. So and preparation depends on the method that you're using, I would say, right? So the how, in terms of, for example, a cognitive behavioral mode will have a different preparation, and a psychodynamic way of seeing the clients will have a different preparation. So it differs, right? From counseling approach, it will, like for example, you're using the Egan skill helper model, then you are going to prepare with regard to that. So and always remember that your sessions should have some amount of preparation before, right? So it's not that the moment the client comes, okay, first session definitely you cannot prepare, okay, you just go with your gut and all of that, right? But second, third, once you know the problems, you have to prepare, right, in terms of how these problems have come up, which techniques would help this client right now, considering all the factors. So you need to have like session goals written, maybe have a book or something, or keep a note of, okay, what are the issues that you have addressed, and how you have addressed it, and what is the outcome, right? Same way, okay, this session you're going to do this by this method, and how you're going to do that, right? Okay, confidentiality being one of the most important factors, is it ethical if we disclose about the client? Yes. Now, that is another question. That is another point, Samita. Good, right? Specifically coming to crime and or suicidality, right? And do these things, these aspects have to be reported, and these things we have to initially when you start with the client, and when we say, right, I know these sessions are confidential, but you say that there are exceptions where person has committed certain crime, or in terms of this thing we have to report it, that has to be conveyed, right? Even if not to the client, at least to the people around, even the informants, whoever comes with the client, if there are, you have to tell that certain matters have to be communicated, that has to be, right? Because otherwise it is against our ethics, right? Now, what happens is, in terms of confidentiality, sometimes initially the counselors don't say that, and all of a sudden this information comes in, and you are forced to say. So what can we do is, if you have not said in the initial time, and that's okay, okay, because sometimes the moment you say it, the client might stop saying what the client wants to say, right? He or she might hide the information. So what we can do is, the during the sessions when the client talks about, for example, suicidality, you can say that according to our ethics, we are supposed to tell at least to one another person, right? It can be a person who, one family member or one teacher, right, in the school. If it's a child, one teacher in the school, or one person in authority, we have to inform, right? Okay. How exactly do we handle resistance of a client? Okay, the client was forced to go for a session, right? So here, a lot of non-verbal, right? Okay, resistance is very difficult to. We use a lot of all this, paraphrasing, reflecting, right? We just just go with the client. Do not go beyond that, and definitely work on the motivation of the client. How you can get the client motivated. So we use basic counseling skills that as we discussed, listening, attending, reflecting, responding, right? And summarizing, paraphrasing. These are the only ways that we can, go and start interacting with the client. And also, at the end, I would say that if a client is forced to go for understand until the client is not motivated, we cannot do anything. Only if the client comes to the point, okay, that the client is willing to work on the issues, then only something will come out of the counseling session. The outcome will be better only if the counseling, the counselee or the client is motivated, right? What or should we keep in mind to deal effectively with someone? Okay, right, who have suicidal tendencies, definitely there is there is something called a no suicide contract, right, which people use, but that is also again a debatable. Okay, so there are therapists who use that, who gets in writing from the client that they won't attempt suicide, but it looks very, I mean, for me, if you ask me personally, I don't believe in that, right? But some okay, what all should we keep in mind with someone who has suicidal tendencies? Definitely, we need to inform the authority, or at least one family member, one friend, somebody who is there with the client. You have to make sure the client is not alone, right? Staying alone, that is one thing. If so, we need to at least get somebody, some friend, somebody, who can contact and be with the client, at least to know, that update, right? And but doesn't mean that the client always have access to you, because it will be like, that literally you are taking all the responsibility of the client, which you cannot. You have the professional boundaries, right? So you help as much as you can. You cannot go beyond that, right? And suicidal tendencies, we always need to look at what were the past attempts, whether they were attempts, what is the plan like, what is the intent like, what is the method of, so all these, suicidality means our approach goes into a more of a crisis counseling, right? So how we are, what is the immediate solution, what is the immediate alternative solution that we can give to the client, right? So that would be our, it would be more solution focused rather than just being passively and seeing that which goals to be prioritized. No, when there is a suicidal difficulty, definitely our first priority would be addressing that, right? If a person is suffering and get depressed, how can we deal with them as a conflict? If a person is suffering from past. Right. Okay. So past problems. Okay. How I would see that is, a present is always a part of the past. I hope you agree with that, right? A present is always having bits and, aspects of your past. So definitely, when you are resolving certain issues of the present, certain things of the past are also getting resolved. So what I would say, if you are very interested to go in depth with the past, definitely you need to learn. So from the counseling, it will go to a therapy approach. So therapy is a more long term, where you are analyzing more in depth with regard to past trauma, and how, there are many techniques, like, EMDR, right? So there are people right now who have done maybe a master's in counseling psychology or master's in psychology, and then go and specialize in one therapy, like, trauma focused approaches, or focusing on one therapy and specializing that and practicing that. So that's something that you can, do. Definitely, somebody who has a very difficult past will need more help with regard to therapy from therapeutic. Only counseling will not help. Okay. Counseling through online media is effective if we can't meet them directly. Yes. We have to go. We don't have any other options right now. Efficacy and efficiency, I would say more research will come up now. I think with Corona and setting in, and, pandemic, definitely everybody has resorted to online counseling right now, and so I think researches will be done and more results will come. I won't be able to tell you about the I mean, what to say, effectiveness right now. But if you ask me personally, um, compared to personal sessions are more effective than online sessions. Okay. How to prevent the risk of suicide due to negative impact caused after attending the counseling session provided by us. Okay. So there's right. So preventing the risk of suicide due to negative impact. Okay. So then that means, okay, here there are two sides to it, right? So one side is, if you are not qualified enough, if you don't have, no, if you don't have the enough skills to deal with that, then you're causing damage to the client. But the other side to it is that, see, even if you're a best counselor in the world, still your client may attempt suicide, or may may die due to suicide. So the moment you take it very personally, as you are a bad counselor, a good counselor, you're putting judgments on you. So the basic thing is you can never be a good counselor, or you know. So how you're going to move away from your value judgments, right? So that would be the answer. I hope you have got it. That even when you are the best person or you've done all you can with the client still may do. So there may be a lot of factors, right? But it's not something that you need to take it personally and personalize it. Right? Okay. How political ideology can help impact health outcomes. Political ideology. I'm not very sure what you are intending to. So whether maybe extremist views or having certain particular political ideologies, I would say mostly I would say it can affect the way you think with regard to things, more extreme way of thinking with regard to, okay, I believe only in this, the other is not at all relevant. So something like that could happen, but I'm not very confident in answering that. I would say how political ideology can it help impact health outcomes. Right? Okay, so I guess I have tried to answer most questions. I'm not sure whether the answers are good enough, but maybe certain questions are very interesting. I myself will go and read again, and get more information about. So I think I'm stopping here. I thank all of you to be a very very interactive group. Usually, when I go for sessions, generally I take a lot of time for students to respond, but you all are very coming out, taking initiative, coming outward, and I really hope that you all continue the same manner, right? And thank you, Miss Liba, in inviting me for this particular session, and thank you all.
Thank you, ma'am. That was an
Thank you,
insightful
ma'am.
and interactive session.
Yeah.
Now I call Sudhira for the vote of thanks. Sudhira.
Yes. Distinguished guest, respected HOD and faculty members, and my dear participants, a very good afternoon to one and all. And it is an honor for me to express my gratitude to everyone present here right now. And I, Sudhira, on behalf of the Psychology Department of St. Aloysius College, extends my hearty vote of thanks to the speaker, Ms. Sunaina ma'am, for enlightening us with her knowledge and views on the introduction to psychological counseling, where she gave us an exposure to the key points such as skills and qualities required and the general format of counseling. And she also explained in detail the levels and different techniques of counseling in a very helpful and useful manner, which made it easy for us to understand and take in. And thank you, ma'am, for taking out your time and giving us a wonderful session. And a session like this wouldn't be possible without rigorous planning and organization. And we have been fortunate enough to have a very motivated faculty team with our HOD, Ms. Liba ma'am, and faculty members Anu ma'am and Mr. Amal sir. My deep sense of appreciation for all those who were a part of organizing this session. And last but not the least, this session wouldn't have been possible without the wonderful participants who chose to be live and attended the session with great enthusiasm and made it a success. Now, once again, I thank you all for being here today and have a wonderful day. Thank you.
Thank you so much.
Thank you, ma'am.
Thank you. Okay, so I'm leaving. Okay.
Okay, ma'am. Thank you.
Okay.